Hello everyone. A pleasant day to all. We are the Group 1 reporter and I am Davon Clyde Rolyorata, the first reporter of our topic about the basics of first aid. And the coverage topic of our group are the sprain, strain, and fracture. Many of us doesn't really know of what sprain is. They have many questions about what are the signs or symptoms and what may be its cause. So, what comes to your mind when you hear the word sprain? A sprain is an injury to a ligament. A ligament is a tissue that connects two or more bones at a joint. In a sprain, one or more ligaments is stretched or torn. There are three signs and symptoms of a sprain. It is pain, swelling, and bruising. Not being able to move or use the joint. Sometimes, people feel a pop or tear when the injury happens. A sprain can be mild, moderate, or severe. And when we talk for its causes, many things can cause a sprain. Falling, twisting, or getting hit hard that can force a joint out of its normal position. This can cause ligaments around the joint to stretch or tear. Sprains can occur if people fall and land on the arm, fall on the side of their foot, and twist a knee.
Okay, let's proceed to the treatment of sprain. First is, what are the treatment of sprain? So treatments for sprains and strains are the same. To reduce swelling and pain in the first day or two, doctors usually say to first is rest the injured area. If the ankle or knee is hurt, the doctor might tell you to use crutches or cane. Second is put ice on the injury for 20 minutes at a time. The doctor might say to do this 4 to 8 times a day. Third is compress or squeeze the injury using special bandages, casts, boots, or splints. Your doctor will tell you which one is the best for you and how tight it should be. The fourth is put the injured ankle, knee, elbow, or wrist up on a pillow. And the fifth is the doctor may recommend taking medicines such as aspirin or ibuprofen. After treating pain and swelling, doctors usually say to exercise the injured area. This helps to prevent stiffness and increase strength. Some people need physical therapy. You may need to exercise the injured area or go to physical therapy for several weeks. Your doctor or physical therapist will tell you when you can start to do normal activities, including sports. If you begin too soon, you can injure the area again. It is important to see a doctor if you have a painful sprain or strain. This helps you get the right treatments.
Next, what is strain? A strain is a stretch or torn muscle or tendon, tissue connecting muscle to the bone. Strain is the amount of deformation experienced by the body in the direction of force applied divided by initial dimension of the body. What areas are the most at risk for strains? The areas of your body most vulnerable to strains go to those areas are your shoulders, legs, think hamstring, and back. What's the most common cause of strains? A strain can happen in a variety of circumstances, everything from overuse, injuries, working out, playing sports too long without proper rest, to twisting, pulling something, or sustaining an unfortunate fall can lead to a sprain or strain. How do they occur? A strain can occur similar to a sprain, where it may be a simple stretch in your muscle or tendon, or it may be a partial or complete tear in your muscle tendon connection.
Now we are talking about the signs of the strain. The sign of strain is the pain, inflammation, muscle spasm, muscle cramping, muscle weakness, bruising, either immediately or a few later. How are the strain Diagnose. Most strains are diagnosed by a physical exam. Your medical professional will examine the affected joint or muscles and take them through their normal range of motion, watching for pain, tenderness, weakness, or instability. How long does a strain usually take to heal? It varies based on the severity of your injury and how much you're still using the area after the injury. Recovery ranges from a couple of days to a
few weeks. Can sprains and strains be prevented? To help prevent sprains and strains, you can: first, avoid exercising or playing sports when tired or in pain. In exercising or playing, we must take a rest if our body is tired. Do not push forward to keep exercising or playing. We must lose our muscles so that no injury will happen. Second, eat a well-balanced diet to keep muscles strong. Third, maintain a healthy weight. These two are the reason we have a strong and good body, because the food that we ate gave our body energy to keep moving from the nutrients we get. Fourth, try to avoid falling. It is one of the causes we have sprain and strain. Observe closely the road, stairs, or anything that we might be fall. Fifth, wear shoes that fit well. Sixth, get new shoes if the heel wears down on one side, because if the shoes do not fit well, it might be too fit or too loose. It can lead to this injury. Seventh, exercise every day. It can help our body getting used of what we are doing every day. 8. Be in proper physical condition to play a sport. 9. Warm up and stretch before playing a sport. 10. Wear protective equipment when playing. And the last one, run on flat surfaces. These preventions reminding us to take care our body from getting hurt and lessen the possibility of getting sprain and strain. These are all the preventions I can give. Take care of yourself and do not forget these preventions.
What is fracture? A fracture is a break in the continuity of a bone. A fracture can range from small partial cracks to complete breaks and can occur in any bone. There are 6 bone fracture basics. Number 1 is the open fracture. So a fracture in which the bone breaks through the skin and can be seen outside the leg. Number 2, closed fracture. A fracture that does not break the skin. This is also called simple fracture. The third is the partial fracture, an incomplete break of the bone. The fourth, the complete fracture. A complete break of the bone causing it to be separated into 2 or more pieces. The fifth is the stable fracture. The broken ends of the bone line up and have not moved out of place. The last one is the displaced fracture. There is a gap between the broken ends of the bone. Repairing a displaced fracture may require surgery.
Since fractures are sometimes unavoidable, here are the things that we can do. The first one is to stop the bleeding. We can do this by wrapping the wound with a sterile bandage or a clean cloth. The second one is to avoid moving the affected area. It is because any movement can result to more serious complications, especially in the case of a head and back fractures. The third one is to cool the affected area. We can do this by applying an ice pack or ice cubes wrapped in a clean cloth. The fourth one is to treat the patient's shock. So we can do this by helping them get into a more comfortable position, encourage them to rest, and reassure them. We can also give them a blanket or a clothing to keep them warm. So the fifth and the most important one is to call the ambulance and help them get a professional help.
The don'ts if you have fracture. Don't move the person except if necessary to avoid further injury. Don't touch the injured area. Don't attempt to realign the bone or push it back if it's sticking up. Don't try to diagnose or treat a broken bone yourself. Just have it treated properly by a physician.